everyone likes to eat, and most of the foods we enjoy are healthful or nutritious. Our eating habits, however, may often lead to tooth decay. Tooth decay is caused by the action of organized clumps of bacteria that attach to and live on the surfaces of the teeth. They produce a sticky, slimy substance which helps them fasten to the tooth surface. These clumps of bacteria are called plaque. When foods rich in carbohydrates are eaten, the bacteria inside the plaque combine with the carbohydrates to produce acids. The plaque holds these acids against the tooth surface. The bacteria go to work almost immediately after usable carbohydrates enter the mouth. During the period of time that acid is present, some of the tooth surface dissolves. Once acid has been produced within the plaque, it may be as long as an hour before it is diluted by saliva, even though the food may have been present for only a few moments. After many acid attacks, a hole begins to form in the tooth. This is called a cavity, or tooth decay. The bacteria prefer foods that are high in usable carbohydrates. Since these foods trigger the production of acid in the plaque, let's call them trigger foods. Some samples of trigger foods are cereals, breads, cakes, pies, cookies, and other pastries. Sweetened drinks, such as soda pops, colas, chocolate milk, coffee or tea with sugar. Jams, jellies, sugar gum, candies, and sweetened fruits. Candies, breath mints, cough drops, and sugar gum are the trigger foods most often consumed. Regular meals usually contain some carbohydrates that can be used by the bacteria. During the day, when 3 regular meals are eaten, the amount of time that the teeth are exposed to acid attack can be seen on this chart. Approximately 1 hour at breakfast, at lunch, and at dinner. This probably would not be enough to cause teeth to develop a cavity. However, let's look at what can happen when trigger foods are eaten as between-meal snacks. At breakfast, mid-morning snack, lunch, afternoon snack, dinner, and bedtime snack. As you can see, your teeth then are exposed to almost constant attack. The amount of tooth decay is directly related to the amount of time that the tooth is exposed to acid. Repeated exposure to attack will cause cavities to form in your teeth. Cavities hold damaging bacteria and food in your mouth and should be filled by your dentist. Some trigger foods are more harmful than others. For example, foods that stick to your teeth or are held in the mouth naturally remain in your mouth for a longer period of time, increasing exposure time to acid. The amounts of trigger food eaten are not as important as how often they are eaten. For example, 2 candy bars eaten each day for 1 week will expose the teeth to acid attack and do much more damage than 14 candy bars eaten at once. One of your natural defenses against acid attack is your saliva. During the day, your saliva helps neutralize some of the acids produced by bacteria. At night, when you are sleeping, you do not have as much saliva as during the day. Consequently, if you eat a trigger food just before going to bed, bacteria may produce tooth-destroying acids throughout the night. You should always be sure that your teeth are properly cleaned before going to bed. If you need snack food, there are many enjoyable snacks which can be substituted for trigger foods. Popcorn is an especially good snack food. Some other examples are cottage cheese and cheese products, fresh and unsweetened fruits such as oranges, apples, and bananas, deviled or hard-boiled egg, luncheon or leftover meats, peanut butter, carrot and celery sticks, or any of the variety of nuts. If you chew gum, it should be sugarless gum. It is not necessary to completely deprive yourself of all carbohydrates, since these are important substances in nutrition. However, for prevention of tooth decay, an important factor is how often you eat trigger foods. Just remember, any food that contains usable carbohydrates remains in the mouth for a long period of time is more harmful than one which is swallowed immediately. Your dentist or dental nurse will help you discover those foods that the bacteria use to produce harmful acids. They may also recommend the use of an approved fluoride toothpaste. Remember to clean your teeth by brushing and flossing thoroughly each day. A clean tooth will not decay.